Hello everybody, I'm Dr. Arvind Krishnamurthy. I'm a professor and head of surgical oncology at the Cancer Institute WIA in Chennai. Incidentally, I've completed 20 years at this place. We are very happy to partner along with the ICGA Foundation, along with other partner organizations like IIT Madras, CCDC and CHIP to host the 6th annual Indian Cancer Genome Atlas meeting, which will be held between November 14th to 16th at IIT Madras. Incidentally, this will be a congress which will bring together not just patients and patients advocates, but also researchers and clinicians who in the couple of days will deliberate on how the genomic landscape of Indian cancers are and how it is going to shape our future management of these cancers. The ICGA basically is inspired by what is called the TCGA. The TCGA is basically the US counterpart. It was established in 2006 by the NCI and many other institutions. It comprehensively maps the genomic, transcriptomic, epigenomic and the proteomic aspects of various cancers. But unfortunately, these database is skewed towards the Caucasian database. There is a very less representation of Indian population or Indian cancers in this database. And from what little data we have about the Indian genome, we know that ancestry wise we are very unique. We probably are possibly part Indo, part European, part Dravidian, part Burmese, part Tibetan. So we have a diversity in terms of our ancestral lineage as well. And the genomic landscape of data of whatever is available shows that it's predominantly centered around breast cancers. And we know that in India, the incidence or the age of onset of breast cancer seems to be a decade earlier. A lot of these breast cancers seems to be triple negative. They are very aggressive. And a lot of these patients seem to do poorly in the long run. A lot of our patients tend to die at least 10 years earlier than the European and the Western counterpart. So that means to say, and from the genomic landscape also, some of our cancers seems to be having a higher burden of TP53 mutations, PIK3CA mutations. Incidentally, some of these mutations and also BRCA mutations as well. The later two mutations are actionable as well, and they can be targeted by targeted therapies, and we can monitor them by measuring the ctDNA levels. The other aspect of it is that knowing that some of our cancers are uniquely different, there is also a scope or a possibility that our cancers may respond differently, and our prognosis of our patients, of course, we know by clinical data they are differently, but we will be able to better understand from the genomic studies. So by and large, it is very important to have an India-specific database. And the Cancer Institute is very happy to partner with ICGA and many other like-minded organizations to contribute to this database of not just the common cancers, but like breast, oral, lung, leukemias, and many other cancers of Indian relevance, so that we can have some India-specific databases, and this can help in prevention, early diagnosis, treatment, and also prognostication of many other cancers. Thank you.